Hello, everyone. Welcome to the briefing. This briefing is presented by WorldAware. WorldAware provides intelligence-driven integrated risk management solutions that enable organizations to operate globally with confidence. WorldAware's end-to-end tailored solutions, integrated world-class threat intelligence, innovative technology, and response services help organizations mitigate risk and protect their people, assets, and brand reputation. Our speaker today is David Hurrell. David is a regional intelligence analyst for the Africa team, monitoring sub-Saharan Africa. He's worked in risk management and intelligence since 2015 and also has experience assessing and analyzing threats across the Middle East and North Africa. David is going to discuss the COVID-19 recovery in 5 countries in sub-Saharan Africa. David?
Thank you, Mary. Good morning, good afternoon, everybody. Today I'm going to be talking about several of sub-Saharan Africa's largest economies, including Nigeria, South Africa, Ethiopia, Kenya, and an outlier, Lesotho. We'll be looking at these countries in the context of 4 medium-term scenarios which WorldAware has developed to show how the COVID-19 pandemic is likely to develop around the world and specifically in sub-Saharan Africa in the next 60 to 90 days. These scenarios are titled Health First, Incremental Normalization, Business First, and No Normalization. We look at key drivers such as medical infrastructure, government action, business response, and public sentiment as we evaluate. I'm going to give a brief description of these 4 response scenarios. While no framework is a perfect fit for any location, the general characteristics of each scenario is as follows. The first is health first. In this scenario, government prioritizes health over normal business activity, choosing life over livelihood, as it were, and maintains strict restrictions on travel and business operations. This has a significant negative business impact, though crucially in this scenario, the government maintains public support. No normalization means that significant travel and business restrictions remain in place, causing, again, significant business impact. The main difference, however, is the public is not on board, with widespread dissatisfaction evident, manifesting as disobedience to government actions, restrictions, growing political opposition, and civil unrest. The government in this situation keeps restrictions in place due to the increasing public health emergency. The third scenario is, the second is incremental on the slide, is incremental normalization. This scenario is what you might call the best case or least disruptive outcome. Government and businesses carefully roll back restrictions and tread the fine line between public safety and sound economic management. There's still a moderate impact on business in this scenario. And again, crucially, the scenario depends upon public remaining positive to a degree. The fourth is business first. In this scenario, governments and businesses prioritize the need to get the economy going again quickly and roll back health restrictions. This has a positive short-term effect for jumpstarting the economy, but also has a negative impact arising from public health issues, likely a spike in cases, and consequently negative public sentiment, which could even be economically counterproductive in the long run. The first of these countries we'll be looking at is South Africa. Our core scenario for South Africa is that the country will achieve incremental normalization. We see this as having a 50% chance of being realized over the next 90 days. When we look at South Africa, we saw that authorities implemented widespread movement restrictions and business closures in March and April after the pandemic really kicked off. Authorities declared a national state of disaster in March. These are all part of measures intended to stem the spread of the disease. Early action by the government was successful in controlling the infection, while authorities maintained a general support from the public despite some early signs of non-compliance. Authorities imposed a ban on public gatherings, ordered widespread business closures, closed the borders to international travel, banned non-essential travel, and implemented a nightly curfew at some point. These measures were enforced by significant security force deployment, which include thousands of soldiers in police support operations. These early days were clearly a cautious health-first approach. However, since June, what we see is South Africa heading towards incremental normalization. On June 1st, South Africa began to relax restrictive measures. South Africa moved to stage 3 as part of a 5-stage phase plan in which limited economic activity was allowed to resume in certain sectors. This is including in the financial, business services, construction, retail, the media, manufacturing, and crucially mining. However, the resumption of economic activities occurred under very specific conditions and subject to health and safety measures. Government plans here are contingent on every stage on case numbers. If they rise too steeply, progress to the next phase could be delayed, with the introduction of restrictions possible. And authorities have made it clear that there is a possibility that restrictions could be increased for hotspots, such as specific provinces, districts, or cities. And we're following daily updates in the media. For example, in recent week, we've seen discussions in Gauteng province, where the Gauteng local government has asked the National Coronavirus Command Council to introduce a higher lockdown level in the province due to a surge in cases. What we also have heard is that this is unlikely to happen, or may not happen, rather the existing restrictions may be more heavily enforced. Authorities have maintained mixed public sentiment over the lockdown, and this has brought time for government to upscale medical infrastructure. We've seen public sentiment in lower income areas have been largely negative, with bouts of civil unrest and criminality linked to lockdown restrictions, while sentiment in middle to upper class areas have been more positive, as these areas are better able to cushion the economic blow. Public sentiment was helped by the actions of President Cyril Ramaphosa, who maintained a visible public presence with weekly televised briefings on the situation. Government is currently not under significant pressure to lift restrictions, despite legal challenges from businesses and opposition. The ruling party has a majority in parliament, no elections are due until 2024, so it's relatively insulated from public opinion in the short term, giving the party time to manage an economic recovery to protect its electoral support base. However, we note that public dissatisfaction in South Africa could begin to manifest in growing disobedience to the restrictions. Our daily monitoring of security incidents in South Africa suggests the country is already seeing an uptick in protests, in civil unrest in recent months. While these appear to be the usual surge in service delivery protests, it's likely that economic grievances that have been exacerbated by restrictions will aggravate these further. According to June 23 data from Statistics South Africa, unemployment rate has risen to a new high of 30.1% in Q1 2020, up from previous quarters and previous years. We've seen that more than 80% of the population is employed in agricultural, industrial, and informal sectors, making long-term business restrictions or quarantine measures untenable. We think South Africa is well placed to achieve ongoing incremental normalization, as the country has relatively good medical infrastructure by sub-Saharan standards, and is better prepared in the case of resurgence of cases due to months of preparatory work. The country also has adequate industrial capacity to upscale healthcare. We saw breweries, for example, producing alcohol for hand sanitizer products, while other industries retooled to churn out face masks or other PPE equipment. We do note, however, that inefficient bureaucracies may result in the temporary or absolute failure of local health systems to manage a major resurgence in cases. For South Africa, we expect a phased reopening to be maintained, in line with the easing of restrictions in other countries around the globe, along with the adoption of pandemic response best practices, as authorities learn from, the collective wisdom of places like Brazil, Italy, and China, where these situations, where cases are being managed, where the pandemic is being managed. Our second scenario for South Africa is the no normalization scenario. We think there's a 30% chance of this being realized. We're seeing at the moment large increases in cases in the Western Cape and Gauteng, although fatality levels are still at the global average. While South Africa's initial health first approach had an immediate impact in terms of reduction in infections and fatalities, it has, you could say, failed in the longer run owing to the near impossibility of preventing local transmission. In part due to major demographics being unable to maintain effective social distancing. People needed to resume economic activities to generate an income. Social welfare is limited. This is especially true in informal areas where people lack water supply and inadequate sanitation services. Under this no normalization scenario, we expect the continuation of current level 3 restrictions, but tailored or revised for certain economic sectors, those involving large workforces, or those conducive to local transmission like mining or manufacturing. Should authorities retain existing levels of economic activities and movement restrictions under a no normalization policy indefinitely? There could be a big increase in negative public sentiment. And lastly, we see a 15% chance of the country entering a business-first approach. This approach is risky. It might kickstart the economy, but might be accompanied by an unmanageable spike in cases. A health-first approach is unlikely because the government simply can't afford to risk cutting everything off. It can't provide the welfare and cannot risk a significant escalation in public sentiment and civil unrest. To put it differently, there's no scenario in which the South African government can be seen as leading an effective response. It can't stop people falling ill. It can't afford to keep people at home. So incremental normalization, therefore, is a balance between business first and health first, allowing the government to manage the crisis opportunistically and manage public sentiment. Over the next 14 days and longer, we'll be monitoring things like indicators such as official statements, changes in level restrictions for cities and districts, verdicts on legal challenges by opposition parties and businesses, evidence that authorities are not enforcing existing legal restrictions. In other words, for example, businesses illegally reopening, cases and infection numbers, of course, public sentiment, and things like hospital bed and ICU bed occupation rates. Our second case study is Nigeria. We see our core scenario for Nigeria is that the country will achieve no normalization. We rate that there's a 60% chance of this being realized in the next 90 days. Our reasoning for Nigeria's no normalization score is that the country's domestic response to the spread of COVID-19 has been poor. International travel was suspended, but only after the importation of numerous cases of the disease. While authorities have lifted interstate travel restrictions in late June, other restrictions such as a nightly curfew and the ban on international commercial passenger travel remains in place. Authorities, meanwhile, continue to struggle with the spread of the virus, in part due to Nigeria's poor public and health infrastructure, which necessitate ongoing restrictions. Crucially, however, public sentiment remains negative, with widespread flouting of restrictions. We've seen failures experienced in the country's already poor healthcare sectors. Doctors have walked out on strike over the lack of resources. These sorts of things could aggravate the state of the national healthcare system in the near future. It's unclear, furthermore, how Nigeria will deal with the global economic downturn and currently very low oil prices, which have negatively impacted state coffers. Barring a boom in oil prices, the Nigerian government faces major financial issues and may be unable to fund a recovery plan. This means the country will simply be unable to afford a rapid upscale in testing, tracing, and treatment in the coming months. Furthermore, Nigeria's supply of basic utilities and telecommunication networks is relatively poor, meaning that normalization efforts such as working from home are unlikely to work. Also, a sizable proportion of Nigeria's working population is either employed in the informal agricultural sector and is therefore unable to adapt to the current situation without considerable effort from the government. There is a possibility that Abuja will attempt to ease restrictions in place. This, however, is unlikely to indicate an improvement in the situation. This will likely be a push to business first scenario approach, given the country's economic troubles and the need to kickstart economic growth. We rate that there's a 30% chance of the business scenario being realized over the next 90 days. A business-first approach, however, would almost certainly bring about a spike in cases with the rapid rolling back of restrictions. With extremely poor medical infrastructure and limited industrial capacity to upscale healthcare, the health system is unlikely to be able to manage a surge in case numbers. Issues around contact tracing, testing, staff payments, availability of personal protective or PPE equipment continues to place stress on an already overburdened system. The easing of certain measures in the days and weeks ahead, such as resumption of flights, will raise the possibility of a business-first approach, as Nigeria's stated public and health services are unlikely to achieve increased normalization or health first owing to negative public sentiment. The indicators we are watching for Nigeria include medical data. If cases continue to rise in the next 90 days, we could see the reinstatement and extension of restrictions. Such medical data could also encourage the continued suspension of international travel. A decline in case numbers would bring about the easing of domestic measures, such as curfews. We'll also be monitoring medical work stoppages, further strikes by doctors and nurses of equipment and compensation. This sort of point to the continued failure of the authorities to improve medical facilities and conditions in the country, necessitating ongoing restrictions, as well as other indicators such as official statements. The third country in our case study is Ethiopia. Our core scenario is that Ethiopia will achieve no normalization. We rate that there's a 60% chance of this scenario being achieved in the next 90 days. Furthermore, we rate that there's a 25% chance of the country achieving business first. Despite restrictive measures imposed by the government, the number of new cases is rising. Ethiopia implemented a 5-month nationwide state of emergency in April, which is still ongoing. Restrictions such as the wearing of masks, border closures, suspension of public gatherings, schooling, etc., are still being enforced. Authorities continue to impose quarantine for people arriving in the country, and there's door-to-door screening in Addis Ababa. Our rationale for the no normalization score is that the number of cases continues to rise despite long-term government restrictions in place, preventing a normalization scenario. Ethiopia faces several challenges in containing the spread of the disease. The country's capacity to prevent, detect, and respond to the pandemic is amongst the lowest in the continent, unfortunately. In addition, government institutions lack enough resources and manpower to enforce effective restrictive measures. The country's weak national health system and lack of capacity for screening, testing, and quarantining suspected cases are factors that make the country vulnerable. And there are vulnerable groups such as refugees and internally displaced people living in camps, low-income areas, overcrowded areas, which have unsanitary conditions and are therefore conducive to the spread of COVID-19, making a response quite challenging. Furthermore, a recession is expected by many through 2020 due to the impact of these restrictions. The country faces revenue and job losses in the industrial, tourist, and crucially agricultural sectors. Meanwhile, many businesses in the informal and formal sectors remain open despite government restrictions. There's a flouting of restrictions. The shortages of basic goods has encouraged traders to raise prices, which is leading to heightened social tensions and therefore increased negative public sentiment. Increased rates of unemployment and associated economic pressures also tend to lead to an increase in criminality. Furthermore, in Ethiopia, political and social unrest has increased in recent weeks as the government struggles to maintain its authority across this deeply divided country. Although recent protests over the killing of a local musician, which prompted rioting in a number of locations just last week, these reflect society's deep frustrations with the federal government. There's also concern that the government is using the state of emergency to consolidate its position, as demonstrated by the indefinite postponement of legislative elections that were supposed to be held in August. Critics note that the Prime Minister is using the state of emergency to repress the opposition and to crack down on opposition demonstrations. Again, this is likely to drive increased civil unrest in the months ahead, making a very difficult situation. Crucially, public sentiment is not on board, is negative overall, and this is due to the factors we mentioned, but also due to insufficient state support in the form of welfare packages amid this volatile political atmosphere. Again, the indicators we will be monitoring are case numbers, of course, official statements on what's going to be, on what likely responses will be, and growing incidents of unrest and anti-government demonstrations, which occur in various regions like the Oromo region and Addis Ababa and Amhara. Our fourth case study is Kenya. In our core scenario like Ethiopia, our core scenario is Kenya will achieve no normalization. And we rate this as being at 40% chance of the scenario will be realized. We also are aware that there is a 30% chance of the country achieving business first due to the need to kickstart economic growth. So this is a bit of a balance. Although authorities in Kenya plan to ease travel restrictions over the coming weeks as part of the nation's phased coronavirus disease recovery plan, structural issues such as a weak national health system amid an increase in cases suggest that significant restrictions will have to remain in place, with the possibility of greater restrictions being enforced in an attempt to deal with increased local transmission. We've already seen medical workers in various counties staging small protests over the government's failure to provide protective kits and enough training on the COVID-19 response. Additional failures in this regard could result in shortages of medical personnel and equipment. The limited capacity of the healthcare sector, coupled with a high likelihood of negative public sentiment in any scenario, means an incremental normalized approach is currently unlikely. And authorities have furthermore warned of a total lockdown if cases continue to rise. We do, however, assess this to be improbable, and this lends credence to our no normalization core scenario due to the difficulty in enforcing a total lockdown. The adoption of such a policy would place significant stress on already stretched state resources. We've seen the closure of Kenya's borders, which has affected trade, including disruption to goods from Uganda and Tanzania, amongst others. We've seen impacts to the agricultural sector under these restrictions. The agricultural sector was already suffering from a locust invasion. This has furthermore raised concerns about food shortages. We've seen economic pressures in low-income areas, and this has led to increased public resentment, increased incidents of social unrest and criminality. In addition, we've seen allegations of fraud and corruption being leveled at officials overseeing what limited stimulus grants have been made available, furthermore increasing public sentiment. However, the situation in Kenya remains dynamic as authorities try to limit both the economic and social damage caused by the disease. Due to the need to prevent further loss of livelihood, we do consider that the easing of travel and operating restrictions would indicate a possible move to the business-first approach, which we'll talk about now. Authorities have stated that domestic flights will resume on July 15, the international flights restarting August 1. However, the easing of certain measures in the days and weeks ahead, such as these resumption of international flights, will raise the possibility of business first, as Kenya states of public and health services are unlikely to achieve increased normalization of health first owing to negative public sentiment. And our business first rating is at 30%. The last country I forgot to mention the indicators. Main indicators we'll be looking out for Kenya is, of course, the number of cases, the number of local transmission of coronavirus, in both at a national level and at city level, which could prompt the lockdown of specific locations such as Mombasa or Nairobi. We're keeping an eye on protests in the country. These lockdowns may prompt bouts of civil unrest and anti-government demonstrations, and again further impact negatively on public perception of government activities. And of course, we're monitoring official statements surrounding imposition or relaxation of travel and business restrictions, and things like the current situation of the health system, whether it's managing or being overwhelmed. The last country now in our case study is Lesotho. We've included Lesotho as an outlier due to its unique geography, partly to compare the country with South Africa and partly to compare it with many of the other countries in sub-Saharan Africa which are facing a no normalization scenario. So our core scenario is that Lesotho will achieve business first. And we rate that there's a 60% chance of this being maintained over the 90 days. Lesotho benefits from what we've called the double bubble, essentially. That even if Lesotho were to open the borders as a result of low case numbers and a business-first approach, people from Lesotho would not be able to easily leave the country or enter the country due to the restrictions that South Africa has imposed. So South Africa, which encircles Lesotho, provides a secondary buffer against imported transmission due to uniformity of travel restrictions around Lesotho's single border. Lesotho was one of the last countries in Africa to report cases of the coronavirus disease. The government implemented lockdown restrictions around the same time as neighboring South Africa. However, authorities had already begun easing restrictions as of early May, indicating business first. Most businesses, schools, public services, and state companies have reopened. This decision has been attributed to the slow onset of COVID-19 in the country. Lesotho has a relatively poor medical system. with little industrial capacity to upscale healthcare. So business first can be a bit risky. Most of the country's medical resources are allocated to fighting the HIV/AIDS pandemic in the country. However, the early closure of the country's borders has seemed to contain the spread of COVID-19 somewhat due to official testing numbers. We're always aware that official numbers could be fudged or not enough testing could be taking place. Well, as the onset of the pandemic in Lesotho has been slow, medical capacity and the response has been sufficient to date in limiting the spread of the virus. So it's in a unique position to reopen without too much risk, at least unless there's a massive resurgence. If we look at the country, 70% of the population is employed in the agricultural, industrial, and informal sectors, making long-term business restrictions or quarantine measures untenable. It's landlocked, it's economically vulnerable, and would severely impact the country's economy. Although Lesotho finds itself in a situation where it needs to mitigate the economic effects that quarantine measures have had on the economy, it's also a great concern regarding the lack of medical capacity if cases increase, as I indicated earlier. Regardless of the inadequacy of business response and the insufficiency of medical supplies, unlike in South Africa, the decision to implement a business-first approach was more welcomed by locals due to the low number of cases. So we've seen a positive public sentiment in this regard. Without a significant easing of restrictions, Lesotho would likely have taken a no normalization approach, as many South African countries have done. In comparison, neighboring South Africa, which implemented a hard lockdown since March, with restrictions being eased incrementally, as opposed to South Africa. Lesotho's main advantage, as stated, has been its total encirclement by South Africa, giving it a unique defense and allowing a business-first approach to continue. I think we usually see business-first approaches in more advanced nations with greater levels of social welfare. The indicators we'll be watching for Lesotho in the months ahead include, of course, primarily medical data. If there's an exponential increase in cases of local transmission, we could see the reinstatement and extension of restrictions, of course. And increased cases could encourage the continued suspension of international travel. A decline in cases could bring about the further easing of domestic measures. We'll be monitoring official statements, cases and infection numbers as mentioned, and public sentiment.